My name is Kelechi Akuma. I'm a vascular surgeon. I'm a surgeon that fixes problems with arteries and veins. I am board certified in general and vascular surgery. Growing up, I always wanted to be a surgeon, but of all the fields in surgery, vascular surgery sort of drew my attention because it's such an evolving field. A lot of other fields of surgery have been well defined for centuries. In vascular, there's an opening, emerging field of balloons and stents and minimally invasive therapies. I think the biggest thing as a surgeon seeing a patient is allaying anxiety, and most of it comes from providing them with as much information as possible in the simplest possible words. And then when you give them all the information, they're able to feel some control back in how they proceed. And that's, I think, the best thing the patients can get. I'm very proud of the work we do, and our team is able to provide a variety of highly complex care in the management of our patients. We're able to push the envelope and allow a community hospital to offer high-end, cutting-edge treatments for aortic dissections, peripheral artery disease, and carotid disease. We're one of the first hospitals in Broward County to provide TCAR procedures, which are the new technology for treatment of carotid disease. We're able to perform complex thoracic aneurysm repairs in patients who would otherwise be transferred to teaching hospitals probably 500 miles away. I think the most gratifying thing is seeing the evolution of how patients do. Oftentimes I see patients in the office, there's a lot of anxiety about the process. They're in a fair bit of pain. The risks of what we do makes the entire process even more nerve-wracking, and just seeing how patients fare through the process and getting to see them in their recovery period and in the office when everything is behind them, I think is the most satisfying thing.